space for conversation around women's health through the lens of naturopathic and Eastern medicine. I am Sandy Ross, and this is Her Earth Medicine Podcast. This podcast is multi-leveled. Episodes for patient education to graduate practitioner level. Thank you for tuning in, and I hope you gain value from this episode. Welcome back to the Her Earth Medicine Podcast, Dr. Maryam.
Thank you so much. Thanks for having me.
So this is the part 2 of our fertility series on fertility in Chinese medicine. So in this segment, we're actually going to be talking about male fertility. So do you want to run us through what is male fertility from a Chinese medicine perspective?
Sure. So male fertility is not something I see as much as female fertility. For various reasons. One reason is just that usually the male partner is a little bit, it's a little bit more reluctant, I suppose, to getting treatment with acupuncture and Chinese medicine. But I do see a fair bit of it. And male fertility has so much to do with the kidney organ system, both the kidney yin and the kidney yang for various reasons. So typically for male fertility, I'll treat both the kidney yin and kidney yang and nourish the kidney yin and kidney yang. And there's always an element to some liver qi stagnation in there. The male partner tends to really take on a lot of the stress of their female partner, I find, when it comes to the fertility journey. And then they have, their other stresses and pressures, pressure from work and whatnot. So I do find that those are sort of the top 3 patterns for male fertility. Liver qi stagnation, kidney yin deficiency, kidney yang deficiency. I don't see a lot of damp heat. That tends to be infection or inflammation based. To be honest, I haven't seen that much at all. Mm-hmm. But I really love giving Chinese herbal formulas. And it's a lot easier to treat male fertility, in my opinion, than female fertility because you don't have to sort of time treatments according to where they are in their cycle. The treatments are generally similar to each other. Of course, it depends, if they might come in with a cold or if they have something come up, of course, you treat that as well. But generally, the treatments that I've performed in my clinic tend to be similar. The men are actually surprisingly very good at taking their herbs. And again, I think it's because they're coming in for fertility and they're really quite good at doing what I tell them to. So as far as just nourishing the kidney organ system, despite taking the herbs, I would say a few things are really important. So overwork is a big deal with these men coming in. So I do talk to them about overwork, like how much are you working per week, per day? Do you take the weekends off? Do you take your work home with you? We have lengthy conversations about this. How is your sleep? I also talk to them about over sexual activity and how it's important to sort of be very moderate and to not have too much sex. And Western medicine, this might be controversial. They might completely disagree with this, but in Chinese medicine, over sexual activity will deplete the kidneys. So that's always a conversation we have.
And that's an important one. Sorry to interrupt, but that's so important, that one, because I feel like you do get told a lot from the Western perspective that the more is better. And, and will increase your chances. But we know from that TCM perspective that no, it won't. It's actually the opposite. We want quality, not quantity. So thank you for touching on that.
Yeah, and I tell them, particularly right before the fertile window to, refrain for, several days at least, so that you can sort of build up your kidney energy. And I talk to them about their sleep and sleep hygiene. So really, what do their evenings look like? Like, are they on their phones reading the news till late at night, and then they have difficulty falling asleep or staying asleep? Are they quite hot? I talk to them about their body temperature. Are they sweating at night? So those are all things that count when it comes to male fertility. And then I talk to them about their diet. So a proper diet with good digestion is so important for the spleen, which is then so important for the kidneys, because the two are so interconnected. So we talk about having easy to digest foods. We talk about having warm cooked foods. I just recently had a male fertility case, and he was really reluctant to stop having his smoothie in the morning. And him and his partner were going through the IVF process. So after the egg retrieval and his job was done, and he came to see me and he said, "Okay, I can't wait to have my smoothies again, because that's like my favorite part of the day. You just like have a smoothie and you're done." So yeah, having a really good nourishing diet is so important for male fertility.
Yeah. And I think with male fertility, I mostly specialize with women, but I'm happy to always treat the men when they come in. And I think a lot of practitioners actually specialize in women because the intensity of their cases is far more complex. And I remember at a seminar a few years ago, there was an analogy given about a switchboard, and it was, like a big switchboard with about 100 different kinds of buttons, and that's like, this is females, and then next to it was like a light switch on off, and this is males. And it like totally stuck with me because it's so complex. We've got to work with the changes in our hormones throughout the cycles. We've got, we've got a uterine change there. We've got the ovarian changes there. With males, it's just constant. And it is a lot of those things like lifestyle, stress, sleep quality, and generally, they are very diligent just to take their herbs, and they get great results from just those few like very simple things that we utilize, versus women where it can be a lot more complex.
Yeah, and then at the same time, sometimes I think, maybe treating females is actually easier, just because you learn so much from just their periods and just their cycles as a whole, and you can really pinpoint their patterns. I find a lot easier than the men, because the men will come in and they'll be like, "Yeah, I'm fine.
Yeah.
Nothing's going on. I have none of these symptoms. Nope, I'm good." And so it's actually kind of hard to come to a Chinese medicine pattern.
Unless the wife's in the room. If the wife's in the room.
Yeah, she'll have something to say about that. But we tend to be able to find some things after I ask really pointed questions. Like they'll say, "Yeah, I sleep well." Okay, so then I start asking, "Well, what time do you go to sleep? How long does it take you to fall asleep? Do you wake up in the middle of the night to go pee? Do you have vivid dreams?" Like all of these things, and then things start slowly coming out.
Yeah, the beauty of Chinese medicine. And I think also using a sperm analysis with males can tell us so much. And that's sometimes happening a lot in clinic now, is when the male doesn't come in, maybe we'll do a Zoom call or something, but just even looking at the sperm analysis and some general bloods can tell us a lot about the male from a TCM perspective.
Right. And I mean, I've had couples where the man is really reluctant to have a sperm analysis too.
Yeah, so have I. Yeah, that's a common one.
I'm not a man, so I don't know what's going on in their head, but that is something that has come up.
Yes,
but they will
I found
end
that.
up doing it after a while.
They will. Okay, so let's dive into maybe a few things in relation to the sperm. So maybe let's talk about low sperm count from a Chinese medicine perspective and what you're doing to support your patients.
I find low sperm count can be due to kidney yin deficiency, and what happens with kidney yin deficiency is that heat that's involved with yin deficiency can dry the fluids and really compromise the seminal fluid. So that's an important piece. If I really had to say, like with male fertility, what pattern I treat the most, it's kidney yin deficiency.
Okay, yeah.
Yeah, and so I tend to do like I don't have like one particular formula that I like for kidney yin deficiency with male fertility. It's usually a combination of a bunch of herbs. So like number one, let's say Shudi would be in there, or Shen Yuro, Nujenza, Dongui would be in there, Bai Shao. So it's usually just all single herbs.
Okay, you're formulating.
What I've been doing in the clinic, yeah.
And then are they coming in for acupuncture? And if so, what kind of treatment considerations are you utilizing and how frequent?
Yeah, I think they're pretty much all coming in for acupuncture right now. And I tend to do a lot of kidney points. So I'll do, again, my favorite is kidney 3. I'll do kidney 7. That's a great one. Kidney 6 is a good one. What else? I like to do Ren 4 and Ren 6. I don't put the heat lamp on their lower abdomen. I tend to just stay away from all heat when it comes to male fertility. But I don't mind to put a little bit of a heat lamp on their feet.
Yeah, okay.
Yeah.
Are you doing mostly front treatments as well, or do you do back shoe stuff as well in your clinic?
I do a little bit of back shoe stuff, but I would say I do more front treatments just because I find that there's just more points on the front.
I think that's a very common thing with fertility acupuncturists is the front treatment.
Yeah. And I do, well, let's say for low sperm count, I do 20. I like to do some calming points, some yin tong. I like to do ear shen men. That's a great one. Liver 3 is a great one too, as the liver channel runs into the genitals. So that's always an important channel to work on with male fertility.
Okay, great. That's some great insight there. And what about things like poor morphology or motility in male patients?
So poor morphology, I haven't seen a whole lot of that in my clinic personally. I'm not too sure why. What I've read about poor morphology is that it tends to be a qi and blood stagnation. And it's actually not that difficult to correct from what I've read. But again, I haven't seen a lot of that. For motility issues, I find acupuncture can be really helpful.
Yeah. I think Chinese medicine works so quickly with male fertility. You can see it definitely in that, after that 90-day cycle, you start to see some big changes in the sperm analysis. And I think also something to add in addition to Chinese medicine is like the oxidation from stress. So you mentioned about stress, and basically for our patients listening, that stress is an oxidant, so it damages the sperm. It's damaging. So increasing antioxidants is also something in addition to everything that you've said there that I would be advising. And that's just some basic nutrients, sometimes like vitamin C and zinc or selenium.
Definitely, yeah. And we do often talk about supplements with the men. So I'll recommend to them, for example, like a good quality probiotic is really helpful, or taking CoQ10 is great for sperm quality. Omega-3 is great for inflammation. And amino acid L-carnitine is often used for male fertility. So we'll sort of go through like, what are you on already and what can you incorporate? L-arginine is another great one for male fertility. So yeah, there's a lot of options for them. And it's kind of a shame that more men are not actually seeking treatment, and it's perhaps more the female coming in.
Yeah. But often the female leaves with something for the male, I think, if they're not coming in at least. But, it is a shame that prior to conception, in those preconception months, that people, not every patient, or not every person, I should say, or couple, I should say, sorry, is utilizing the benefits of how to actually increase the sperm quality and the egg quality so they can have a much healthier outcome for their child. Because that's the beauty of doing the preconception work, is we're going to change the epigenetics basically, or the gene that we're passing down to the child.
Exactly. Yeah.
What about with males? So often a lot of them might be having some beverages in the evening, alcoholic beverages, or potentially even like with the oxidants, some smoke, some don't. Do you discuss those kind of stimulants and what should be considered in the pre-fertile windows?
Yeah, that's such a tough one, especially right now. I do find that more of my patients are talking about how, they're kind of resorting to wine at the end of the day, just to give them something to look forward to be honest. So that is a tough one. I tell them to try to not have any alcohol whatsoever, because, again, if they're sort of on that time crunch, which a lot of fertility patients are, they're really willing to cut it out, or they might have already cut it out. Being in Vancouver, it's not often that you come across someone that smokes, to be honest.
Wow.
Yeah, I mean, people are very health conscious here, so that hasn't really been an issue with any of my patients. And then just the other things like avoiding heat, like saunas, hot tubs, those are really important, and they tend to already know all of those things, but I like to give them an actual list of things to avoid and what they can incorporate into their lifestyles. And I just kind of give it to every male patient that comes in. I tend to like to just have that, guideline to always refer to.
Yeah, and I find men are good like that too. You give them a list and they'll just do whatever you say. The fertility female patients are a lot like that as well, but I find in general across the board with men is they just want things written down and they'll just follow it.
Yeah, exactly. And you kind of have to just, maybe not give them too many things to start. Give them a few of like the biggest things to work on, and then you sort of go from there. Baby steps.
And what about things like exercise?
Yeah, so with exercise, I tell them to just be moderate, and to not do exercise that's going to really overheat their body and deplete their yin even more. So if they're sweating profusely, maybe to have an eye on that, and maybe they can tone down their exercises.
Yeah, and I guess the same goes for like bike cyclists, especially when they're in those little shorts and whatnot too.
Yeah, oh, definitely. Actually, the patient of mine, the smoothie guy that I was talking about, he's also a bike, like a cyclist, and he was so happy to get on his bike again after the egg retrieval. So, yeah, that is something that, I think it's all important.
Yeah.
It all plays a role.
And I think obviously if they're going through IVF, they're particularly being told these things by their fertility specialists. So they're getting the education, but I think for patients listening that maybe haven't gone down the IVF route yet, that, hearing some of the suggestions you said about the exercise and the sweatiness downstairs, it's actually very important from that TCM perspective to try and help with the regulation so we're not drying up the fluids down there.
Yes, exactly.
So thank you very much for touching on that. And just one last thing to go into, because you mentioned about withholding a few days before the fertile window. Can you maybe be a little bit more specific with that for our listeners?
I would say, if they can, for example, like during the period, I recommend that couples don't have sex anyway, right? So that's a perfect time for the man to not ejaculate. And then after that, let's say around day 9 or so of the woman's cycle, they can start, and this is again assuming that, let's say her cycle is about 28 days. Around day 9, they can start to have regular sex. And that would mean, I get this question a lot, like, do we have sex every single day during the fertile window or every other day? And I really think that if there aren't any sperm issues necessarily, it would be okay to have sex every day during the fertile window. But if they've been told that they have low sperm count or any motility issues or whatnot, then they can try just for every other day, so that there's not, they're not depleting their kidney energy for, too much.
Yeah, I think that's plenty. I actually studied in China once I finished my studies in Australia, and where I studied was a Chinese martial arts academy for the first part, and we were being trained in Kung Fu and Tai Chi and Qigong and Chinese medicine by Shaolin monks. It was amazing. Wow. But I remember the monks constantly saying to the males about withholding ejaculation and how that's going to deplete their jing, and I kind of had heard it a little bit throughout my studies, but it was really interesting to see it straight, from the horse's mouth basically, and being able to pass that on to patients and explain that to them, because they are kind of being told constantly, you got to do it every day, you got to make sure so it's really great for you to kind of reiterate that for our listeners, so thank you.
Yeah, and I think they've even been told, like, I've had many patients say, oh, well, my doctor just told me to have sex throughout my wife's whole cycle, as much as we can. And, it's hard to compete with what their medical doctor has told them. But all I can do is just give the Chinese medicine perspective and, yeah.
Dr. Maryam, is there any last pearls of wisdom in relation to male fertility that you'd like to share with us?
I think that one of the biggest things for male fertility is that element of just being overworked, and for them to really try to rest more, to have more downtime, to sleep early, and try to really work on their sleep hygiene. I think that that's really quite important, and to just do whatever they can to bring their stresses down and to have less pressure.
Okay, great. Well, thank you so much. You've given us some great pearls of wisdom from a traditional Chinese medicine perspective.
Oh, it's my pleasure to be here.
And if for our listeners that might be, maybe they're abroad in other countries and whatnot, do you do Zoom consultations for herbal medicine?
Yes, so I do online consults, I do in-person acupuncture and herbs right now, and I also offer online courses. So I have talking about male fertility, I have a male fertility online self-treatment course. So it's just a self-paced course where they learn customized diet and lifestyle recommendations that fits their pattern. And they also learn customized self-acupressure. I also have an IVF online course and some other courses. So that's a really interesting new project that I'm undertaking.
Great. Where can they find that?
So that's all on my website, ChineseMedicineClinic.com.
Okay, great. I'll be sure to check them out as well. Once again, Dr. Maryam, thank you so much for your time, and it's been lovely chatting with you about female and male fertility.
Thank you so much for having me.
Thank you. Thank you for listening. I have been a practitioner of naturopathic and Chinese medicine for over a decade. I have a master's degree of health science, and I am an academic lecturer at Australia's leading natural medicine college. I am available worldwide online for bookings. Simply go to sandyrosshealth.com.